Good afternoon. I hope everybody's had a good day. I tell you, I'm one of those that thoroughly thrives on sunshine. I've got a job where they make sure I'm in rooms where the sun can't get. I don't think it's they try to keep the sun from getting to me. It's everybody else from getting to me. But it something about driving down. The mountains are always pretty, and I encourage you to come visit us in Eastern Kentucky. But beautiful day to drive down. It's good to be here, and it's good to see each and every one of you. You know, I'd be remiss if I didn't start out, and it drives Shauna crazy when I get off script. But I'd be remiss if I didn't tell you, though, how appreciative I am of this group. And I'll obviously repeat it at the end because I guarantee it, I know each and every one of you will agree with me. Everyone on this committee is so busy with everything else that you have in life, but yet you find time for it. I used to joke about it sometime when I'm coming down as the chief at the Court of Appeals. I said, every now and then you got to let me do my day job, and that's actually show up. So I just want you to know on my behalf and on Justice Conley's behalf, we greatly appreciate the time and effort that you guys are putting into this. We really do want to welcome everyone to our March meeting of the Kentucky Judicial Commission on Mental Health. And I always laugh. We always tell you where you're at because you never know. I've had times where I'd sit down and I go, oh, wrong meeting, wrong file. But we're glad to have you here with us today. Some of you, I was looking on mine, but you may be wondering, there is a blue ribbon. It should be in your materials that you have today. And March is, for those that may not know, but March is Developmental Disabilities Awareness Month, which gives each and every one of us an opportunity to recognize and reflect on the experiences of individuals with intellectual and developmental disabilities, including those who come in contact with our courts. And if you think about it, honestly, that's what this commission comes down to. We're trying to do what we can to improve our court system for those with disabilities that do come in front of us. This work is closely connected to the Commission's effort to improve accessibility, training, and system responses. This ribbon is just a small reminder and symbol of our commitment to inclusion, understanding, and better outcomes. Honestly, and I hope you'll join with me as I make sure I get mine fixed before I leave, but hopefully for the remainder of the month, you try to wear those in recognition of this month. We want to go shortly, take a look. I think next on our agendas is the talking about the commission updates. In your materials today, you're going to find the agenda, minutes from our December meeting. Lord, it doesn't seem like it's already been 3 months since we've been in here. You will also find a printed copy of the final 202A virtual forum report. This report reflects the work completed through 14 regional forums held across the Commonwealth this past year. And honestly, that was such an amazing undertaking to bring together that many people in that many locations. This forum brought together judges, clerks, law enforcement, behavioral health providers, hospitals, and community partners to have honest, solution-focused conversations about how the 202A process is functioning in our communities. And it's been a wonderful opportunity. You know, as I was looking over my note today, from 2 or 3 of the committees, we look at some of the issues that each and every county, be it Jefferson County or Pike County, are dealing with are the exact same issues. We always tend to think the larger cities have an answer to everything, and a lot of times they have an answer to a lot that we just don't have in some of the rural parts of our state. But it seems like we still all suffer to some degree from the same issues. And one of the wonderful things about this forum is it really is helping us to focus. What you're going to see in the report is a comprehensive summary of what we heard. It highlights the key barriers, as I was speaking about earlier, that continue to impact our system, including in Eastern Kentucky, a huge issue is the transportational challenges, delays in evaluation and medical clearance, limited capacity, and ongoing communication gaps across agencies. I can tell you I've been blessed, and this is my 31st year as a judge, District Circuit Court of Appeals, and it's the greatest honor of my life. But one of the things that's always amazed me is we're all part of the same Commonwealth, and I can go from county to county, and we're operating under totally different procedures. And that's one of the big goals of this committee. So as a unified court system, we need to have a unified way of dealing with this. And this has been very helpful. At the same time, it's important to recognize that these forums also revealed strong collaboration and innovation already happening. One of the first things we did in Pike County when we started, they encouraged us to have these forums locally with our groups. And we were actually surprised when we brought our community together. We had a lot more services that were available out there than we knew we had. So I think it's been one of the wonderful parts of this organization. Report's not just a summary, but it's a roadmap. It's given us guidance, and it's intended to inform the work of this commission, guide future training and resource development, and support the recommendations to the Supreme Court, the General Assembly, and our agency partners. The findings make it clear that improving the 202A process will require continued coordination, clear expectations, and sustained investment in our behavior health system. Most importantly, this work is about the people. It's about ensuring that individuals in crisis are met with a system that's timely, coordinated, consistent, and focused on dignity, safety, and access to care. I can't begin to tell you how much we appreciate the engagement of all those that have participated, taken part in our forums, and contributed to this report. I want to give out a special thanks to Secretary Stack, Commissioner Marks, and their team, who were once again at the table with us. I can't begin to relay how invaluable that's been to us. It's an important step forward, but is only the beginning of our work that lays ahead of us. Let's see here as I'm going down my checklist. Community mapping continues to move forward with strong momentum across the Commonwealth. Recently, we had workshops in Clark and Hardin counties, which resulted in targeted, locally driven action plans addressing crisis response, housing, transportation. You know, one of the things I think I've noticed, as I said earlier, every report we get, transportation comes up. We just can't get people into the treatment we need to get them to. Deflection and youth services. In addition to hosting workshop, efforts now include ongoing technical assistance, follow-up meetings with these groups, and support to help communities advance their identified action steps. Multiple additional workshops are scheduled, reflecting continued statewide engagement. I would encourage you, we always inundate you, I think, when you come to this meeting with so much material, but I would encourage you when you get home or when you do have a little bit of downtime, take a look at some of those reports. Very, very informative, and I think you'll find them very helpful. And it does give you a really good look at what we're dealing with statewide. I want to give you a little bit of update on our legislative recommendations. This year, as most of you already know, we've been working on House Bill 485 this legislative session. House Bill 485 represents the Commission's legislative recommendation from the Competency Work Group addressing KRS Chapter 202C during the 26th session. This statute governs the involuntary commitment process for individuals charged with a qualifying offense who are found incompetent to stand trial and have no sustainable probability of regaining competency. To further examine these identified concerns, a focus group of subject matter experts was convened to review the statutory framework and develop proposed amendments. House Bill 485 is sponsored by Representative Nemus, and the provisions amending KRS Chapter 202C reflect the work group's recommendations. The bill also includes additional legislative changes relating to 202A. Although the Commission was invited to provide feedback, it is important to note that only the 202 portion is actually the part that is Commission recommendations. Since this bill's filing, Commission staff and work group members have worked closely with Representative Nemus and Moser to define the language. We are grateful for the continued partnership on this important issue. Judge Colron provided testimony on the 202C provisions in February, and the bill passed unanimously out of the House. Now, to give you a little bit of update, I went online this morning checking. The bill was referred to the Senate on February the 20th, and at least as of early this morning before we came in here, it had not been assigned to committee. And one of the things we do have some concern with is, as most of you already know in this session, it wraps up on April 15th. So we'd really like to see something, if at all possible, through the legislature get referred to committee, because we've got to get it there before we can get it on the Senate floor. So I would encourage you, if you talk in conversations with your Senate representatives, please let them know, and I'm sure you probably already have, the importance and significance of this bill, because we don't want it to not make it out. So we got to get some movement in the Senate with it. Following Director Ramsey's presentation on the work of the behavioral health liaisons, we wanted to begin providing a quarterly report to provide this group with greater visibility into their impact across the Commonwealth. The report highlights how behavioral health liaisons are strengthening coordination between the behavioral health and justice systems, improving crisis response, and supporting better outcomes for justice-involved individuals. It also reflects the work happening on the ground through enhanced case navigation and strong community partnerships, while outlining key challenges and emerging trends. Moving forward, these reports will continue to evolve and will include more data as tracking systems are enhanced to better capture outcomes and impact. With that having been said, I think we'll now move into, Shauna, unless there's something else we need to address at this point, we'll now move on to an introduction of our speaker for today. It is my extreme pleasure to introduce Commissioner Matthew Cole from the Department of Vehicle Regulation with the Kentucky Transportation Cabinet. Commissioner Cole has served in a number of key leadership roles with the KYTC since 2015, including Director and Assistant Director of the Division of Driver's Licensing. Before being appointed Commissioner in that role, he has led significant efforts to expand access to services, improve efficiency, and modernize systems across the Commonwealth. It was during the 2023 town hall meetings that we first recognized how often behavioral health issues intersect with transportation. Since that time, Commissioner Cole has been a valuable partner to this commission, helping us better understand these connections and the opportunities for collaboration. We're so grateful for his engagement and are excited to hear more about this work today. Please join me in giving a warm welcome to Commissioner Cole.
Thank you all very much. I already checked the first box. I got up the steps without falling, so we're off to a good start. Just to show how DVR supports this message, and DVR is the Department of Vehicle Regulation. Obviously, the Division of Driver's License is within that the department. But DVR is not part of the clinical or judicial side of the system, but we support the administrative infrastructure that many of our systems rely on. We know just from ground zero, if someone doesn't have an ID, it makes it harder for them to have access to services, just to get housing, a lot of identification purposes for other programs issued by the state. So we know that that's a linchpin in that conversation. My goal today is to briefly explain how the identity systems, licensing, reentry support the intersection of the work that this commission is doing and what we'll always do to try to support that mission. In many cases, a stable identity and access to identification is the first step toward stability for individuals interacting with the courts, treatment systems, and community programs. So one theme that comes up repeatedly in the commission's work is the system breakdown when processes are inconsistent or that information is unreliable. That's one thing that we've been focusing on for quite some time, is to make sure that our programs not only logically make sense, they comply with statute, but that they're also user friendly as much as possible. We've gotten vehicles off of our mainframe, and now we're going to do a modernization this June that will get drivers off of a mainframe and onto a web supported system. So we're hoping with that, that'll be the new chapter that'll allow for us to have connectivity with other government agencies and kind of hopefully give more information, get more information, and make those transactions more complete. While DVR doesn't provide behavioral health services, we do help ensure the administrative backbone of the system works properly. This includes identity verification, consistent statewide records, and standardized processes across our regional offices. We are up to 35 regional offices across the state now. I can happily report that wait times are down, appointments are more readily available. We're seeing people with appointments, wait time is about 10 minutes before being seen, and walk-ins are waiting about 12 minutes on average across the state. Those tend to be a little heavier in the bigger communities and a little easier to get into on the more rural, smaller offices, but we're continuing to take strides to have that consistency across all the offices. So one of DVR's core responsibilities is ensuring that individuals are accurately identified in state systems. Through Real ID standards and document verification, we confirm identity through every transaction that we do. Social Security, residency, all the other portions of that process that we continue to make sure people have proper documentation on file to confirm that identity. That matters for courts, law enforcement, service agencies who rely on those records to make decisions. And ultimately, reliable identity systems help protect due process and individual rights, which makes sure that it closely aligns with the Commission's focus on all of their initiatives. One area where DVR intersects the most directly with the Commission's mission is reentry. We are doing over 3,000 reentry IDs every year in conjunction with the Department of Corrections. So that's an initiative we've been very proud of, starting out as a very small pilot, just a couple locations, and now I believe we support 17 of their locations. So we'll continue to hopefully grow that program, because we understand that somebody leaving those facilities and having an ID in their hand just gives them one better step in cutting down on recidivism. Because obviously, without identification, it becomes extremely difficult to access basic services such as housing, employment, benefits, or treatment programs. Our reentry efforts work with the corrections partners to help individuals obtain a state ID before release whenever possible. And then something as simple as having an ID can significantly reduce barriers to stability and not putting them back into the same situation that they found themselves in. Fast. Another area where we try to contribute to reducing administrative friction is for law enforcement and courts. Our regional offices system and standardized procedures help ensure licenses are issued, handled effectively, efficiently, and consistently. Consistency is a focus of ours. As mentioned just shortly ago, you can go county to county and see different procedures. And we know that every office of ours has its own personality. Some require more appointments, some lean toward the preference of walk-ins. We adjust each one of those, but we're trying to make sure that we standardize the processes and the way the information is collected and the IDs and driver's license are produced. That consistency is so important for us to have a legitimate system and program. Modernized systems and customer service improvements reduce repeat visits and documentation problems. We have a great amount of information on all our programs on our website, drive.ky.gov. Please go there whenever you have any type of issues. And if something doesn't stand out there or it's not as clear as it should be, please let us know. We're constantly fine-tuning it and making sure that it's a good resource for all of our agencies. The goal was simple. When the administrative systems run smoothly, other agencies can focus on their core responsibilities, including crisis response and public safety. The Commission's work is focused on improving outcomes for individuals experiencing mental health crisis while maintaining public safety and due process. We support that mission by strengthening the identity systems and helping remove administrative barriers. In particular, our work supports reentry and access to IDs, so that way many of the programs that you all present can be activated and utilized across this program. We look forward to continuing to support the Commission's work in any way that strengthens the overall system. We're always available for a call, meeting. We know those conversations where we get started, there's always a problem, an issue, a concern, and hopefully we can come up with a solution that kind of helps provide guidance or just makes the day a little bit easier. I'll be glad to take any questions. We can open it up anywhere across driver's license if there's a personal issue, if there's questions about TSA and their new program. Confirm ID is out there, so glad to assist if anyone has any questions. All right, you had your chance. All right, I'll check the last box, get off the stage, not fall down, and we'll move on to the next section.
Thank you, Commissioner Cole, for sharing with us today. And again, as I said earlier, you have been and continue to be an integral part of the Commission's work, and we're so grateful for the update that you provide us this morning and for taking time out of your busy schedule to be here with us today. We'll now go into our committee and work group updates. In your material, you're going to find the quarterly reports for all the work groups. And honestly, our work groups, I think, are the core of this organization. We always like to brag on everybody. It takes time to be here, but the amount of work that these work groups put into, that's really, I think, what helps drive this organization. So I appreciate each and every one of you. And our first report's going to come from Wes and Wes Duke. Wes, I was looking over my notes last night with this, and I think you've been with us since the inception of this committee, have you not?
I have, and it's been a lot of fun.
All right, Ted. Most of you already know, but for purposes of introduction, Wes is with the Cabinet for Health and Family Services. He's here to give us an update on the Treatment and Access Committee. Wes, as I said earlier, we sure appreciate what you being here, and we appreciate what your group is doing. And I know Amy and Secretary Stack appreciate you covering the committee for them today. So with that being said, I'll now turn it over to you, sir.
Thank you, Judge. Appreciate that. And it's my pleasure to be here today. I'm obviously filling in for Dr. Stack. He gives his regards. And I'm going to introduce the update on the Treatment and Access Committee. They met on March 13th. And the committee has been focusing their efforts on treatment. I'm sorry, on working on and developing training materials and initiative to try to enhance Kentucky's court processes and doing work in that space, and they continue to do so. The priorities that they've focused on have mainly been developing education materials to strengthen those communities and to share what is working statewide and make sure everyone has access to that. So we have three work group leads I'm going to lean on now, and the first one is Crystal Adams, and she is from the Department of Behavioral Health, Intellectual and Developmental Disabilities, and I have no idea how you roll that out every time you introduce that. That's hard. So yeah, but we have Crystal here to give her report.
It's a lot of words. It's not easy to do it without getting tongue-tied. So good afternoon, everyone. The Intellectual and Developmental Disabilities Work Group has met 3 times since the last quarterly meeting. We have met in November, January, and in March. At the end of last year, we did a survey of our work group participants to try to get more information on what they would like to focus on in the coming year. And the results of that have been reflected in the 2 meetings we've had thus far this year. The first meeting we had, we focused on alternatives to guardianship, and we had representation from the Human Development Institute to come and speak to our group on supported decision making. This is something that we are now working on developing a training for individuals within the court system on what that looks like and what those processes should be like to determine what level of support an individual may need as an alternative to guardianship. We also have several other things that were identified under the guardianship umbrella, but as you all know, we also have a guardianship work group. So we have reached out to them and Stacey Tapke and ensuring that we're staying in communication and working collaboratively on some of these efforts related to individuals with intellectual disabilities in regards to guardianship. For our most recent meeting, we were privileged to have Dr. Slusher from KCPC come and present on some of the work that they are doing for restoration of individuals who have been deemed incompetent due to having an intellectual disability. And they were able to provide an overview of the great work that they have been doing, both inpatient at KCPC as well as at their outpatient sites. And we're going to continue to explore additional opportunities with our other work groups to collaborate on things that cross our various sectors. Thank you.
Thank you very much. And the second report was from Judge Burke. And Judge Burke is unable to be with us here today, so you can just refer to the materials that you have. And is Dr. Jasinski on the call?
Yes.
Okay, all right, excellent. Yeah, the third report is in the Strengthening Community Work Group, and Dr. Lindsay Jasinski from the University of Kentucky is going to be giving that report. Sorry about that, Dr. J.
You're fine. That's almost as difficult as Crystal's title, so I totally get it. Thanks everyone for allowing me to present today. I unfortunately have to present virtually because we've got some folks here visiting Empath. So multitasking this afternoon, but did want to give an update on the Strengthening Communities work group. We have met twice in both January and February since our last commission meeting. We continue to work on a work plan that really heavily focuses on stigmatizing language and the impact throughout an individual's journey in the community that stigmatizing language can have. In our last meeting, we actually had an individual come, Ryan Shoup. She's a social worker actually here at Eastern State Hospital and has recently published an article on the impact of stigma. So she analyzed several different sources of information and looked at the impact of stigma on individuals' willingness to seek care, any kind of medical care, and the impact that stigma and stigmatizing language had from the provider side. And both the providers and the individuals seeking healthcare identified that stigmatizing language as a real gap and a barrier for access to care. So we oftentimes think of stigmatizing language around lack of help seeking for mental health and substance use, but it actually means that folks are less likely to seek any kind of medical care as well. And that's a significant problem in our communities. So we have been working on a work plan around developing a training related to stigmatizing language. Some of this work has been done previously, and so we want to understand what has been effective and what maybe hasn't reached the audiences that we need it to reach. So we're continuing to evaluate some of those current resources and figure out how can we create a training that is going to, or information that can be shared community-wide that's going to have an impact on reducing some of this language. Everywhere I turn on a daily basis, I see language that is stigmatizing to those with mental health, substance use, and intellectual disabilities. And so I'm hoping that we can really sort of make an impact in the community that way through that, improving our use of language. And that is all for my report. I believe our next meeting is this week on Wednesday.
And I'll pass it off to the next work groups.
Before we move on to that next work group, I would ask if anyone has any questions either for Wes or for the group chairs from his committee. If you do, I'm sure they'd be glad to answer. If you have a specific question, now they're going, Judge Thompson, don't do that to us.
Where's my micro? Oh, I just had a quick question for Dr. Jasinski. I was curious what the timeline is for the training, because that's something I would love to be offering at large scale offerings, so we can be having that spread throughout the criminal defense community.
Yeah, absolutely. I'm not sure that we have a defined date for that. Our initial plan was to do sort of a fireside chat or a group discussion at the next judicial summit. But then we've sort of revisited that and we're looking at ways that we can divide those up, maybe into smaller training sessions to make them really user friendly. So we can certainly update you when we have a timeline. We're hoping to nail down some of those details this week at our meeting.
Any other questions? All right, and Wes, I want to thank you and your work group leads for your continued excellent work and help to this commission. Thank you. We'll now go to our next group, and we have Brenda Rosen for the Civil and Family Justice Committee. Brenda, I know you have a new title. Congratulations. For those of you that may not know, Brenda is now the Executive Director of the Kentucky Social Work Advocacy and Justice and Leadership. And we'll now turn it over to Brenda and her respective work groups, and congratulations.
Well, thank you so much. We have to regroup sometimes when we get fired for being over 60. So we'll talk more about that another day.
There should be laws, you think.
There should be. Yes, yes. But anyway, it's a pleasure to be here. And obviously, the wonderful Judge Cutoff and Chris Griffith couldn't be here today. So, and I'm not sure if Stacy is here, so you might just have to bear with me for all three of them. This quarter, the Civil and Family Justice work groups have been focused on advancing key priorities in their workplaces. And key areas have included providing recommendations and revising AOC forms to enhance court processes and developing resource guides, trainings, and other educational materials, including the Domestic Violence Victims Support Worksheet, which is amazing. And you can find those in your meeting materials. I will go ahead as sitting in for Judge Brown here. So 3 things happened. Bench Cards, the subgroup finalized 2 training series, Understanding Perpetrators, Offender Accountability and Intervention, presented by Chris, and Kentucky's Batterer Intervention Program, presented by Nick Davis. The Domestic Violence Advocacy and School Subgroup are really doing some great things related to school-based approach to dating violence prevention. Had an overview from KSAP and the services that they are providing. And the subgroup is developing resource guides for schools titled Advocating Safety, a School-Based Approach to Dating Violence Prevention. So a lot of good things happening in that group as well. Third is the multidisciplinary teams subgroup, and the subgroup finalized the Victim Information Guide, which is a resource aimed to increase accessibility to domestic violence services. And this is it. This is amazing. So you all take a look at this, something that can definitely be shared. And they're also looking for curriculum for recovery centers and peer support specialists, and a lot of kind of integrating with other community partners and developing some informational materials. Next up, for the Honorable Judge Vanover, the DNA Dependency, Neglect, and Abuse Work Group has been very busy enhancing collaboration and communication with system partners. And the group is leading the next phase of Relationships Matters training series. And the always wonderful KJCMH staff is developing and distributing a survey to family court judges and district court judges without family courts to gather input. Also, understanding the role of treatment providers subgroup, F&Q resource guide regarding the role of treatment providers, and waiting updates from the Administrative Office of Courts Legal Department, which are amazing. And in future meetings, the subgroup is also going to explore bench card, the role of treatment providers. Best practice. Subgroup work group is exploring opportunities to collaborate with the domestic violence work group, which is wonderful, and enhancing training for court-appointed counsel subgroups and continuing with some of their training sessions, Owensboro, Pikeville, and Louisville. And finally, because I think Stacy's not here. Okay. 3 for 3, y'all. Hang on one more second here. Alrighty. 2 work groups that Stacy has been working with. One is a guardianship work group and the commitment work group. And This is really interesting. UK Human Development Institute on Supported Decision-Making, which is an alternative to traditional guardianship that allows individuals with disabilities to retain decision-making authority while receiving support from trusted advisors. And also working to improve clarity and efficiency within the guardianship process. Lots of good action items, which are all in your handouts. And the commitment group has heard a presentation for Cabinet for Health and Family Services on the updates of the 1915 Medicaid waiver, which we all know well, which provides community-based behavioral health services. And again, some really good action items here. And lots of good reading for you all in the packet. Thank you.
Brenda, thank you so much. You did an excellent job with all the committees you've got going there. We have a lot in your committee that are actually doing their day jobs today, I have no doubt. But no, seriously, we do appreciate the work and the work each one of your work group leads is doing on that. And we appreciate so much you giving the update for us today. We'll now go to our Criminal Justice Committee update provided by Judge Mayer.
All right, good afternoon, everybody. I will first, of course, say thank you to all of our work group leads, our committee members, our AOC support staff that does a great job keeping us moving forward, and particularly right now when we're in a busy season, I think for most folks who are here with the Judicial Mental Health Commission, given that it's a full legislative session as well, a budget session. So we appreciate everybody's time and extra attention and your availability. I won't be as efficient as Brenda, which is not probably a surprise to anybody, but that is in part because we've got 3 of our 4 leads here today. They're very talented, they're very insightful, and they're going to give you firsthand updates. I will go ahead and say that our reentry work group lead, Erica Hargis, was not able to present today. She attended for a bit, but had other commitments, so I will direct you to look at that report that's in your materials. And then I'm going to go ahead and say we'll have Dr. Slusher, my colleague Judge Tackett, and Steve Shannon presenting today. And I'll let you all just pass it to each other for the sake of efficiency and respecting your competence. So Dr. Slusher, you're up first.
All right. Hello, everyone. So our competency work group has met twice since we last met as a commission, once in January and the second time in February. We have, when we talk about system improvement, we all came together to look at the clerk's manual, which does not have actually any directives on how to go through the competency evaluation and restoration process. So we are working with them. We're very appreciative to them to have the opportunity to explain the process and see where this takes us in terms of manual updates. And we have also had presentation from Ian Shepard, if he's here. Thank you, Ian. He's done a great work with us on looking at the utilization of form orders for Seth's Law. So those are 3 form orders that were created in response to Seth's Law that help guide the court. And he was able to pull some data for us that show they're not probably being utilized as frequently as we would like to see. So we're going to look at some next steps around that as well. And then we always talk about some trends in KCPC and our larger system that we've worked so diligently to expand. So for KCPC, our wait list as of last Thursday was 47 are waiting for, while are in jail waiting for an inpatient service at KCPC. And interestingly, only one of them is female. So I've talked before around, we have a really small female population, both on a wait list and inpatient at KCPC. The time frame for an inpatient service at KCPC is around 2 to 4 months. It's much shorter on the closer to the 2-month mark for females who are waiting. But of course, I just mentioned we only have one who is waiting in jail. Our outpatients, so those are the services that we provide that Seth's Law has allowed us to do. And we are about a 12-week wait list for our time frame for completion of an evaluation. So from Seth's Law that allows us to do these evaluations outpatient, we have about a 10% rate, 10 to 11, of unable to determine. So those are the patients who come into KCPC on the evaluation side. So we serve those patients for more complex evaluation needs, and then the restoration patients under 60 days of court order. And so we always look at the restoration rates for inpatient, but because we've expanded the service delivery system to include jail-based, I thought I would share with you that we have completed services for 81 individuals in our first jail-based program in Louisville. And of those, 52% were restored to competency. And that is aligned with national data that we see on restoration for jail-based programs. So we're proud of that. And it is fairly similar to the inpatient service that we provide at KCPC. That's about a 60% restoration rate. And if those of you have heard me talk about this over the last couple of years, before we made all these changes, we had about 90 to 95, I think, it was before my time, but individuals who were restored to competency. And so the reason for the decrease in restoration rates is because it's really sending us the individuals who need that inpatient care, so they're sicker and have more complex treatment needs, so the restoration rates are lower. We also have our Fayette County jail-based program, which got going in the fall of 2025. So we're working through that program development. And let's see, what else? So we mentioned 485, House Bill 485. So we've already talked through the elements of 202C. As of today, we have 17 individuals at KCPC who are under 202C commitment status. And I think that's about all I have, unless you have any questions for me. I see some talking.
How about you want to send him out the DVI? Oh, yeah. Thank you, Shauna. We were just having a conversation earlier, and it was a continuation of one of the meeting conversations that we had about the forms that are not quite being used as much as we would like, but getting better every day.
Yep.
And one of the places was the Department of Public Advocacy is possibly has more steps we can be taking to share those. So I'm very pleased you'll be at our annual conference and one place to share them there. But we're also going to take additional steps and send them out to the agency again, along with explanation videos from the website, which I just learned about today. And then also possibly a webinar, pardon me, if that's ever an opportunity.
Sure. Well, just feel free to reach out. We can talk about how I can help you with all that. Thank you. Oh, I was supposed to turn it over to someone else, right? So I'm sorry. I will turn it over. Judge Tackett.
Actually, I had Steve Shannon next, but so Steve, you want to go?
Sure. Again, this is Steve Shannon. And y'all, what's happening here? All right. I'm with the CARP Association of 12 of the 14 community mental health centers. And I have the privilege of chairing the pre-arrest and diversion work group. We've met actually January, February, March. And really, we spent a lot of time talking about a jail survey that we've been looking at for a fair period of time. And it should be noted that I think that is close to completion. We had a fairly significant number of jailers that participated. And our next step is going to be looking at that data and what does it tell us. And I think this is going to impact recommendations going forward pertaining to the pre-arrest and diversion work group. I think it's something we've been talking a lot about. We greatly appreciate the local jails. It's obviously been a big lift for them. And our partners at the University of Kentucky who conducted the survey and is collecting, reviewing, and analyzing data that they'll share with us, and we'll move forward on that. So we appreciate that. The other thing we heard about recently was the Georgetown Police Deflection Program. Had a presentation at our last meeting, and the focus is getting people away from appropriately to services instead of the criminal justice system. And obviously, I think that's clearly part of our diversion focus. And really, it's let's get people into treatment as opposed to, and then maybe get them in a path where they don't end up involvement with the criminal justice system. And that's what's been our focus. We'll continue working on the jail triage results and recommendations. And that's, we look forward to meeting again. We will not meet in April, but we'll meet the first Monday of May. All are welcome to join us. And we always meet the first Monday. Thank you. Appreciate
No, so I am here to give the juvenile justice work group announcement, and I'm actually filling in because there is a vacancy here for a work group lead, and I've been asked by Sean and Heather to promote this lead. If you are interested in becoming the work group lead, I hear it pays really well, and according to Heather. Please consider it if you have any interest in juvenile justice. So I was not there, unfortunately. So I'm going to go with the script because I had a docket in the middle of this meeting. January 18th is when they last met. And during the reporting period, the Juvenile Justice Work Group received a presentation on teen dating violence, highlighting the intersection of issues being addressed across both the juvenile justice and domestic violence work groups. The discussion was particularly timely as February is recognized as Teen Dating Violence Awareness Month and provided an opportunity to strengthen awareness and collaboration. Subgroups continue advancing related work to ensure coordination across priority areas. The Legislative Priorities Subgroup during the reporting period, the Juvenile Justice Legislative Subgroup received an update on Senator Carroll's High Acuity Youth Bill, SB 125. In addition to monitoring the progress of SB 125, the subgroup has offered to submit feedback, review, draft language, and identify potential expert testimony as the bill moves through the legislative process. Additionally, the subgroup has continued its focus on development of juvenile competency standards. Current discussions have focused on the absence of established juvenile competency standards in Kentucky and the importance of examining how other states have approached the development and implementation of such standards to help inform future recommendations. And then there was a mapping priority subgroup. And during this reporting period, the mapping subgroup received a presentation from the Council of State Governments on risk-based services, reoffending, and approaches to improving service delivery for justice-involved youth. The information shared provided insight into how service strategies and resource alignment can influence outcomes for youth involved in the justice system. The subgroup plans to use this information as it continues exploring how existing resources may be better utilized, promoted, or modified to support improved outcomes. In addition, the group is working to solidify a 2026 strategic plan to guide future work. And then as far as their action items, they're going to continue to explore the development of juvenile competency standards and finalize the mapping subgroup's strategic plan for 2026 and identify opportunities to strengthen existing resources for justice-involved use. So again, if you have any interest in becoming the work group lead, it's a very prestigious title of the Juvenile Justice Work Group, contact Shauna or Heather. Thank you. Now, I need to pass it on to Erica Hargis, who is the visitor, who is going to do the reentry.
Erica signed in earlier but was not able to stay, so I'll just direct you again to your information in the reports. And then there was an historic event that took place on Saturday that I'm the circuit judge in Clark and Madison counties. I'm obligated to recognize. And that was Go Cards, because we are now the men's and women's state basketball champions. Go GRC.
Seriously, Judge Mayor, that congratulations on that. But thank you and your work group leads for your updates to know. I know you stayed extremely busy on that. Judge Mayor, or Judge Tackett, I saw an invitation you just sent out, and I'd like to take just a second before we move on to give us an update on your program that you have coming up.
Yes.
Very interesting.
I'd be happy to. So we are having our annual mental health court graduation celebration and alumni homecoming in Fayette County. And it's an event. We are, there's some mental health courts that are operated and administered through AOC and funded. We're a little bit of a different beast, unicorn, if you will, that we are administered through the NAMI Lexington. And so we receive all our funding. So we're a mental health court that's administered by a consumer group, which gives us a little bit more flexibility. And so we asked for the city to come and fund us. And they've been a wonderful partner from before I was even on the bench. It's an opportunity for our graduates to be recognized by local leaders. And this year, we've had several justices speak. The mayor speaks. Justice Conley spoke last year. Justice Lambert has spoken in the past, and this year it's going to be Justice Goodwine is going to grace us. And then it's an opportunity for not only our participants' stories to be showcased, and their talents to be showcased. We've had art exhibits before, we've had music. This year we have a stand-up comedian who has played in New York City and Chicago who's going to entertain us for a few minutes. And then also just to hear some stories of amazing transformation and restoration. It's a really great event. It's going to be at the Kentucky Theater on May 18th at 3 p.m. The public is welcome. So if you can attend, we would love to see you. And it's going to be at the state, so I guarantee you there will probably be room. It's a pretty big theater. So thank you, Chief. Appreciate it.
Judge Sackett, I just thought it was an excellent segue for me to get into our agency roundtable, which was letting us know what's going on in your area. At this time, I'd like to open the floor up to anyone else. If you know of anything that's going on exciting in your agency is working on, or whether it's new or a new initiative or an update on something, an existing program, we'd like to open the floor up for just a few minutes and let you share that with us. As Judge Tackett did, I really like the comedian approach. That got my interest and got it put on my calendar.
I guarantee you that we've probably made some of his material after being in our court for a year. So I can't wait to see how he's probably going to rib us pretty good.
Thank you. Seriously, anybody else have any updates for us from their agencies? Yes.
Yeah, I'd be happy to share a few things. Rural health transformation. I know some people are getting updates in pockets, but I wanted to share just the enthusiasm that's underscoring the behavioral health arm of the rural health transformation that's being led by our Department for Public Health, but is, again, one of those representations of how our cross-agency, cross-system collaboration works effectively. So in the behavioral health space, we're really thinking about increasing the crisis care continuum with a couple key initiatives. And so the anchoring idea is the expansion of the empath unit. And I know so many folks in this room are familiar with the amazing work that UK has done on the site of Eastern State Hospital in partnership with New Vista to create 23-hour crisis stabilization and really change the trajectory of so many lives, preventing hospitalization, increasing access to outpatient appointments and engagement. And so we're going to replicate that model, and we're going to move into Eastern Kentucky first and also focus on Western Kentucky in the coming years. The reception from the early adopters is so positive. They're excited. Community mental health centers are rallying around this. We're having meetings nearly every day to envision this in our rural community. So excited about that expansion that's coming. Paired with the empath expansion is also going to be growth in our community paramedicine model. So equipping first responders to be able to respond to the calls that they already go to, but where behavioral health is the core of the emergency. And so building out that community paramedicine model will increase our ability in even more rural communities to have some crisis response. And then a telepsychiatry or telebehavioral health hub that allows more folks to access clinicians virtually. And that can be connected to so many different settings, whether it's law enforcement response or follow-up after an empath unit visit that needs an outpatient service. It's really going to increase our capacity and reach. And then a data linking system that really connects our entire crisis continuum so that we can follow someone, maybe even from a 988 call, all the way to the moment they come into a 23-hour stabilization to their outpatient appointment. The opportunities with rural health transformation to change kind of the system across the state is really exciting, and just wanted to pass along that enthusiasm. A couple other things, the 1915I Rise, we already heard that mentioned once, but just continuing to build momentum there. That's the new state plan amendment array of community-based services for folks with serious mental illness and co-occurring substance use disorder. Our most recent numbers, we have 10 active providers operating across 4 different regions of the state. And so we call them the community mental health center regions, not necessarily the community mental health centers themselves. So in the 7 counties region, the New Vista region, the Kentucky River region, and the Pennyroyal region, we're all active. We've had 100 individuals referred for assessment at this point. So really excited to cross that first threshold. And the last thing I'll mention is just a great partnership that we've been able to establish across a couple different entities to roll out trainings on ASAM, the American Society of Addiction Medicine, their 4th edition, their newest criteria for how we determine the level of care that folks need for services. It is a significant growth in understanding and accounting for the complexity of individuals and helping them to get matched to the right level of care. And that requires a lot of new training across the state. And so far, we've had 418 people, clinicians specifically trained in this. And we're going to continue to roll out more trainings through some kind of unique funding opportunities. We're also interested in growing training specifically in the forensic space and really appreciate some of the early conversations we've had with the court responses work group and possibly having a collaboration there, also in the peer support space. But the data is really impressive. And you guys know I always have to make some nod to data, but of the 418 individuals that were trained in this first round, they reported that they felt that they were more capable. They went from 50% of people saying they felt comfortable serving at-risk individuals to 86% at the end of the training, saying, I feel comfortable serving at-risk individuals. That's a huge, huge growth. The other one was they went from 54% to 88% confidence in treatment planning and clinical decision-making. So this is a uniquely positive, impactful training. It's a one-day event. We've got some series that go from beginner to advanced. So more to come. We'll continue to push those out. Trainings are getting sold out. They don't cost anything, but filling up in a single day. So the demand and interest is huge, and we hope to keep meeting it. I think that's what I'll leave it for DBID today. Thanks.
And I have one quick follow-up up to that. Dr. Langfeld and Dr. Stack would both be really upset if we did not tell you that you can learn everything you need to know about rural health transformation at ruralhealthplan.ky.gov. And it's actually, there's a ton of stuff there about what the cabinet's doing and what we're working on and what our plan was and what got approved and how to, and if you know providers that want to get involved. And so any questions, everything is right there. So it's a really, really, really great resource.
Thank you. Thank you, Wes. Anybody else have anything that's going on with your agencies or in your region? Yes. Oh, this side of the
very
room.
busy.
All right.
Yes.
The cabinet's
Wes,
very busy
have you
right now.
prompted everybody over there,
Yeah,
Wes, to
yeah.
speak?
Good afternoon, everyone. As you know, the Department for Community-Based Services, most of you know, we have some challenges with youth in out-of-home care, youth and foster care, with placement and treatment. So over the past, since 2022, we've been talking about the issue with children who with complex behavioral health needs and the inability to find treatment to meet those needs. It's not a placement issue. It's not a capacity issue. It's the treatment needs of these youth far exceed the ability of the providers that currently we partner with and work with to meet their needs. And you likely are aware that recently, within the last week or two, there was 2 reports released regarding this issue. One was completed by the auditor's office, and then there was another independent audit that was completed by the Finance Cabinet's Office of Inspector General. These reports were very different. The OIG report followed what we would recognize as a traditional audit approach in that they engaged the cabinet in those discussions and conversations and included information. Again, gives opportunity to review and respond to some of the report. The auditor's office did not. And again, that was very disappointing because we would have welcomed that opportunity. Both reports, while they recognize the issue of children without placement, and the cabinet again has been very open about that. But again, it's not placement; it's treatment for children with very complex behavioral health needs. Well, they both recognized again what the issue was. The OIG report also highlighted that this was a national issue. It's not something that is unique to Kentucky. This is happening in many, many states across the U.S. and internationally. I was reading an article this morning talking about this same issue occurring in other countries as well. The OIG report also included and recognized many of the efforts the department has been making to address this concern. They also recognize, the OIG report recognized that the occurrence of children that are without placement and staying in what we term as a non-traditional placement. They're staying in a local DCBS office or other setting while we are working on that placement and treatment need. That occurrence has decreased decreased by 50% over the last year. The OIG also report highlighted again that this was not a placement issue, capacity issue, that it's a treatment issue. The OIG report also recognized systemic and causal factors that contributes to, again, the concern. It recognized that 3 primary issues around legislative changes that while, again, the right things occurred through these legislative changes around diverting children from detention. Nobody wants a youth in detention, but what that has caused is then the children within the care being placed in the care of the department, again, when our providers did not have the capacity to meet some of those complex needs. DCBS contracts and partners with providers who the same provider network that's available to any other child that's in the community. These are providers that are working and helping around issues of abuse, neglect, dependency, and trauma. So some of those more aggressive behaviors, and more, again, aggressive and more complex needs, they're not able to address. The pandemic, they also recognize the impact of the pandemic on mental health needs of our kids. And then some recent federal changes that have replaced more stringent requirements on congregate care settings, such as residential settings. The APA report listed a number of recommendations, and if they had given us opportunity to be a part of that report, we would have been able to share that many of those recommendations we have already done or in the process of implementing. So I would just encourage you to read both reports before if you want to get a full picture of, again, the issue. Most of you are aware of the issue, especially our judges, because we work alongside you each and every day to address the concerns. But just, again, I would encourage you to read both reports. Thank you.
Yes.
So to piggyback on the rural, and also happy Social Work Month, Commissioner Dennis. Thank you for all you do. Just wanted to quickly, a couple of things that we're working on. One is the Mental Health Insurance Reform Task Force, which started here in Kentucky with all disciplines in mental health and behavioral health, has grown to 40 states. And the goal of this group is advocacy, mental health parity, kind of reevaluating what we need to do in terms of coverage, stopping clawbacks. But I'm really Kentucky proud, and we all should be, because this definitely represents our state well. The other thing, Cayenne's Law, House Bill 246, we're supporting this. We started a group with some amazing people called the Kentucky Human Animal Welfare Coalition to address the connection between human and animal violence. And so we've got a lot of things going on with this group, and really piggybacking the intersection with domestic violence, SUD, and mental health issues. So if anybody wants to join this. And we're also doing period poverty collection in honor of Social Work Month that we're going to carry through the rest of the year, and that is to try to curb the horrific loss of menstrual care products for kiddos in schools. 65% of all girls in schools don't go to class because they don't have enough product. So that's another thing we're elevating. Again, feeds into the whole mental health that we're trying to improve. Thank you.
Judge Roberts, Commissioner Cruz and I were talking, and we can't let CHFS steal all the thunder in the room. They do it at every meeting. I mean, this is not unusual. So I just wanted to give a quick shout out to Commissioner Cole and mention another program that the Justice Cabinet partners with the Transportation Cabinet on. Many years ago, 7 years ago now, we realized, Commissioner Cruz and others, that the biggest issue that's getting a lot of our folks violated on probation and parole is transportation issues. Can't get to a treatment appointment, can't get to a job interview, can't get to the probation and parole office. So we reached out to the Transportation Cabinet to work with the transportation providers that do non-emergency medical transport for Medicaid and asked, would they be willing to haul our folks around when they needed rides? We've been running that program now 7 years. It's worked seamlessly. It's really worked really well. And I think we've kept a lot of people from reoffending or from being technical violators by that program. Earlier, we also heard about a Senate bill that might be a little stalled. We have another one. Senate Bill 90 from 3 years ago established the behavioral health conditional dismissal program, right into the deflection and diversion that Steve was talking about. It's been a good program. How many counties are we in now, Jason? 18, 19, 20, somewhere in there. The results are good but mixed. We need more time. We need more study. So we have another Senate Bill 90 that's cleared the Senate. It's assigned to A&R right now. So if you find yourself speaking to a member of House leadership, please encourage them to move this bill along so we can continue this work and prove that getting people the services they need is far smarter than warehousing them to play cards and sleep in jail.
Anyone else? I always find it informative and enjoyable when this group starts to share because we really do. I think we all have so many common problems that we deal with. But anyone else have anything else you'd like to share with us? Well, Lisa, I will tell you, I want to go back to yours after 20 years as a family court judge. I don't know what I would have done without your agency. So I'm also smart enough to know if the public looks at us, there's some that love us and some that hate us. And I always said as a family court judge, if I was fair, half my clients walked out hating me. And if I was real fair, they both walked out hating me. So, but I just want you to know your work is appreciated by those that are in the system. So thank you so much. And I appreciate the updates. If we have nothing else, Shauna just looked at me. And now I know you think whoever chairs this meeting up here has control. But when I got to go, can I speak now, Shauna, huh, can I? All right, I'll turn it on. It's green. You can go for a couple. No, I did want to look at you. And Shauna said, you know, it looks like we're going to finish early. I said, now, if it's a problem, there's enough politician in me, and you know that I'm a talker. I can get us to 3 o'clock if that's what you want. But I had an impression that's not what she wanted on this Sunday afternoon. So, you know, as we come to the close of today's meeting, I said at the start, and I'll close with it. I sincerely thank each and every one of you. I know how busy you are, and I know on behalf of Chief Justice Lambert and Deputy Chief Justice Connolly, how much they appreciate the work you do and you being here. And they also wanted me to share with you their apologies for not being able to be here with us. And I'm kind of like the Mikey of the appellate system. I give it to Thompson. He'll do it. I'll show. No, I thoroughly enjoy it. And it's an honor to come in here and to listen to what each and every one of you are doing and what collectively we are accomplishing. You know, as we move forward, 2026 honestly is off to a great start. We're still hoping we can get some more movement out of the Senate and passage of some of these bills that would work to the benefit of the commission and those in the Commonwealth and needed the services. But all things considered, if you look back on the past few years since the implementation of this commission, I will brag on you collectively. We have enough chiefs in this group, chief, deputy chief, whatever. I've always found the state of Kentucky is wonderful about giving titles. We're a little slow sometimes on raises, but we get some really, really, really nice titles. So I'm now at the age, it's like, I really don't want any titles, just, you know, pay raises are nice. But we appreciate it, and we do. It is a partnership, even obviously with our legislature, as much as I like to give them grief occasionally. But it is it is a privilege working with every one of you. Every project, every partnership, and every conversation we have, I think, moves this commission forward, a step closer to more responsive, compassionate court system. And that's ultimately the goal of this because, you know, and again, sometimes all I can relate to is what I've done for a living. And most of mine was in family court or district court. It used to break my heart when I'd hear the only response to help a child was to lock it up because we have no placement. nor can we help the child short of having them committed. And I've always thought that was just such an atrocious way to deal with anyone in the Commonwealth of Kentucky, much less our children. And tell a little story about myself. Before I was a judge, I was an attorney. My office was actually in another state, practiced in both, but there I actually sat on a state board because we had no place for these special needs children to put them. And our board had to decide where we were sending them out of state. So as I always point out, sometimes as tough as it is, we are really blessed to have the system we have, I think, in Kentucky, because we're always willing to work to improve it and to make it go forward. And a lot of that sits on the shoulders of everybody in here. And I just want you to know it is appreciated. I want to thank you all again for being here. Hopefully you have safe travels as you head home. Absolutely beautiful, beautiful out there. If you're going 75 through Lexington, prepare to stop occasionally. Seems to be a few stoppages. We look forward to seeing everybody. Our next meeting is June the 3rd. Sean has asked me to remind everybody, please leave your name badges and your table tents. I wasn't sure what that was when you was telling me to tell them to leave that. I go, I didn't get one. I'm joking. No, but please leave those. And I would encourage you as we're about to adjourn for the day, if we would, but please, I would encourage you, contact your senators. I know this is a wonderful group to do it, but we would love to see some movement in the Senate on the bill that came through the House for us. So we know they listen to you. We know you have a lot more clout than you probably think you have with our legislators. So we would encourage you to contact them. If anything comes up, and as I wrap up, as I would always say, I want to give thanks to Shauna. As much as I love giving her grief, I don't know how much we function as a collective group without her going, come on, Judge, get up and do it. But Shauna, you are appreciated. Don't get spoiled. I'll work on a new title for you. What would you like? But no, we appreciate your work. And to my immediate left, I want to thank Director Ramsey. They are nice enough. I think every meeting we've had, they've hosted us here at AOC. They fed us well here at AOC. And Director Ramsey, I appreciate you greatly. And
Thank you all.
Jason and everything. I've tried to thank everybody here at AOC I could think of. You do validate parking out there, don't you? Okay.
Absolutely.
But it is sincerely appreciated. Unless we have anything else, or Shauna, you can think of anything else I need to remind everybody. Have a wonderful evening out there. Enjoy that beautiful weather, and we'll get you out of here a little earlier today. Thank you so much for being here.